Without further ado, allow me to introduce today's speaker, Carolyn Feep. She is the kidney transplant dietitian at the George Washington University Hospital. Prior to her current role, she worked for a dialysis company as a dietitian. In her career, she seeks out opportunities to educate the general public about the importance of early detection of kidney disease and the value of a healthy diet for kidney health. Carolyn supports content development and review for the American Kidney Fund's Kidney Kitchen, a nutrition website that helps people with kidney disease navigate healthy eating. In her spare time, you can find Carolyn walking all over Washington, D.C., taking pictures and searching for new and delicious restaurants or farmers markets. Thank you, Carolyn, for joining us.
Well, thank you very much, Molly, for having me. And I guess right now my search for delicious restaurants is on hold, right, as it is for everybody in the country. And it kind of walks us right into the next part where it's COVID-19 and living with kidney disease. So there is, this is all new for everyone here. We haven't, lived through a pandemic, and this is a brand new virus for us all. So people are just kind of scrambling, and really the best way to go and find out what you need to do is by going to the CDC, to their website, going to the AKF to their website, going to places that you trust, right? So like DaVita has a good website because everybody who's doing this backed through science, right? The American Association of Kidney Patients, the AAKP, or the Kidney Community Emergency Response Coalition. These are all great places that are going to be coming with you or to you with real science-based, not fear-based education of what you can do to help support yourself and your family through these times while living with kidney disease. Next slide. So really, what are some kidney-friendly foods that you can stock up on? Again, there's a lot of good information, and these are links like to tips for shopping for a 3-day emergency diet, shopping foods for that you can stock up in your fridge and freezer and pantry. It's going to be kind of funny because like when we're going to go through this, we're going to talk a lot about eating fresh fruits and vegetables. But when it comes to emergency time, making sure that you have some staples that are pantry safe and that can stay, food safe out of the refrigerator on your shelf for a long period of time. And it's always just kind of good to have that in your pantry always, because you never know when something like this is going to happen, or when a snowstorm, or now that we're moving into the spring, an electric storm or like a lightning storm, and you lose your electricity. And so having good kidney-friendly staples in your house is important. Canned tuna is good. Low salt or no salt saltines. What else? Like some like pastas and jarred like pasta sauce that you can thin out with water, or things like that. Food delivery. Right now, I'm not sure where everybody, this is nationwide. So like right now in Washington, D.C., all of our restaurants are closed, right? But they are delivering to us. So it's like, how is that safe? Like hopefully the food delivery guy is being safe. So always, cooking for yourself is more important, is where that you're going to get it to be safe. But then we all go out to eat, and doing food delivery. I mean, so choosing foods that are going to be low in potassium, foods that are cooked. So instead of choosing that raw salad, get something that's cooked. Get a dish that it has to be all the way cooked, so that way there is no possible foodborne illness, and things like that. Choosing like chicken instead of beef, because it's just a little bit more on that healthy side, or choosing a hot vegetable but low potassium vegetable dish. How can you get emergency dialysis? That is another great question. That is when emergency dialysis, you always call your dialysis unit first, and they are going to have the best recommendations of how to get you in for your dialysis treatments. They might also tell you to, hey, we can't get you in right now, so these are some things that you can do. You can really cut back on your fluid. You can really cut back on any type of foods that are high in potassium. So kind of going more to the like just plain rice or buttered noodles, or really kind of stripping down that diet of yours, avoiding protein because protein has a lot of potassium in it as well. Doing things like that. And then if worse comes to worse, then you have to go to the emergency room. But that is after you have called your dialysis unit, called your doctor, things like that. If you're feeling like short of breath or your heart is racing, those are certainly the times when that happens. But hopefully your dialysis center has reached out to you or will be reaching out to you in any type of time of crisis, be it a snowstorm, a pandemic, or maybe a tornado or hurricane or things like that. Next slide.